Pleasure to invite our esteemed chief guest, Dr. G.S. Wander, an illustrious alumnus of this college and now Chairman Board of Management, Baba Farid University of Health Sciences, Faridkot, to kindly bless the students with his words of wisdom. Sir, please.
Dr. Deepak John Bhatti, Dean Academics of the Baba Farid University of Medical Sciences and a famous plastic surgeon from Faridkot. Dr. Rajan Singla, Director, Principal and Professor of Anatomy of this prestigious medical college. Organizing Chairman, Professor and Head of Surgery, Dr. Ashwini Kumar. Organizing Vice Chairman, Head of Pulmonary Medicine, Dr. Vishal Chopra. I have had the privilege of working with Dr. Vishal Chopra. He's a member of the Board of Management along with me. And we keep learning so much from him, and it's indeed an honor to work with him in the Board of Management. Medical Superintendent and Professor of Surgery, Dr. Harnam Singh Rekhi. Esteemed faculty of this prestigious medical college, proud parents, members of the press, ladies and gentlemen, and most importantly, the students of the batch 2015 and 16, for whom we have all collected today for the annual convocation today. At the outset, I would like to thank the organizers for giving me this honor to be a chief guest at my alma mater. I am humbled, sirs, by this kind gesture of yours. It has been a very enjoyable and a satisfying morning for me to see such bright, smart, energetic young boys and girls who have been awarded the degrees today by the respected principal and the dean of the university. Annual convocation to all of us is a very important day in any institute since it allows us to look back on our achievements of the last couple of years. Ironically, here it's been long, maybe 10 years, but generally one gets to see where all we have reached. And also we can plan for the future, what's the direction that we want to move forward with regards to our teaching, research, and service aspects. The sight of these young medical graduates working, wearing this robe with the hood and some stable and some not so stable bonnets on their head is very fulfilling, satisfying, and it was an enjoyable experience for me to award the degrees to all of you. These teachers are today feeling very proud because they have been involved in your inception process into the field of medicine. For the parents, of course, it's the culmination of a dream that they hold in their heart and mind for a long, long time. In fact, in most of us, the Indian parents, from the time of the child birth, I would say, the faculty of this college needs to be commended for the highest level of care that they are rendering to patients of this region. The academic levels and teaching standards of this college are well recognized world over. And at present, in fact, the alumni from this institute are, as I gathered today, a couple of boys and girls have gone to the All India Institute, Delhi, Maulana Azad. So boys and girls from this institute are able to go and get educated and further serve in some of the best institutes in the world. So in that sense, it speaks of the very high academic teaching that you people have been imparted. I have been an integral part of this institute. My father, Dr. Harjeet Singh, served this institute as a professor of medicine and rose to the level of a vice principal. He worked here from 1962 to 84, and I have very fond memories of coming here. I was just sharing with Vishal, as a young boy to the sports day, we used to come here and we used to get those boxes of snacks and we used to really enjoy, carry them back home. So we have nostalgic memories of this institute. Each one of us in various medical colleges in the state, as the Dean sir just said, we are doing commendable work in our own sense. But probably what I feel as now as a chairman of the university, that we need to collaborate with each other so that we can bring out some Punjab-centric data which is helpful for the patients of this region. We look at the problems of our patients from our own viewpoint, something that states like Kerala and Tamil Nadu has done. Hopefully in the next coming years, the faculty of this institute and also of other medical colleges will collectively work for some collaborative research activities which we can undertake, and it will bring actually benefit to the patients of this region. This day, of course, belongs to you, the 400 students of the two batches. I am so happy most of you are here, although some of you are doing post-graduations and have come from faraway distances. I would like to speak personally for the next 10 odd minutes to all of you, since I can look back to 1982 when I graduated from this prestigious institute. I know the present generation is wiser and smarter than us. However, I feel for the simple reason that I have spent 40 long years after my graduation, I can look back at my life and maybe give you some simple tips and advices, which I know youngsters don't really relish from my experiences. But the white bearded and white haired people are so much actually used to giving advice that you will have to bear with me for the next couple of minutes. The first thing I would say is that it's an occasion for you to celebrate the great achievement of yours that you have. Since you have now entered the noblest of profession, people will call you Chota Rab at times. Since we all get more than what the respect that we get is more than what is due to us, it is good to have confidence, self-respect, but please avoid overpride and ego, which will sometimes tend to creep in as people pay their respect and regards to you. On the other hand, one should be ready to face some blame at times for no fault of ours because the practice of medicine is changing. And for that reason, we need to maintain a mental balance, a physical and mental strength within us. Do not let success go to your head and do not let failures, don't take them to your heart. The good and bad times are going to keep changing, and you should maintain your poise, your grace, and your composure because that is what is expected of a good physician. Keep working with care, compassion, and empathy towards your patients, since this is what is going to give you satisfaction and it's also going to bring success for all of you. I would again reiterate something that we as young graduates used to do. We used to spend a lot of our time in the playgrounds. The present generation, because of this information actually explosion, tends to, so your physical, mental strength is something which is going to withstand with you for the coming future. Well, friends, the world is open for you and the choices are innumerable. There are plenty of opportunities you have. However, you have to make your own choice and you have to create your own path and then leave a trail. Have courage and faith in yourself. Follow your heart, follow your intuition, I would say. Do spend some time to know your own self in a better way. We often look at other people and situations, and at times we feel that our future depends on others. Actually, it all lies within you and within all of us. Every individual, you and me, we are all unique and different. We have different skills, different assets, and of course, limitations too. Peeping within, spending time with your own self, and I would say identifying yourself will always help you to pursue what suits your aptitude and your mindset. Some of us have better hand skills, others can analyze data better, some others have good clinical judgment. So it's important for you to know what kind of an individual you are, since there are a lot of opportunities. Some of you have already gotten into post graduations, some are still trying to get in, some might go abroad. I was just talking to a couple of students, they're appearing for USMLE, some might go into different professions also. You will also find your life partners. Some of you would have found by now, and I'm sure this is the time when some of you are looking for your life. So it's a very, very important phase of your life, I would say. The shadows and the support of your teachers, the intrusion by the parents is going to be less, and you are going to be more and more answerable, I would say, to your own self. So in that sense, there is a greater responsibility on your own self. Look at the long term and the larger perspective of life. Sometimes we get really bogged that this student got an award, I did not get the award. Actually, you are all equal now. Some of you have been awarded prizes because the ability to reproduce what they read is better in them. But those who did not get those awards, I'm sure a lot many of you are going to do excellent in your life because you are restarting a new phase of your life, and what you will do now is actually going to determine the future for you. This is also a time, my dear friends, for gratitude and thanking the Almighty God, your parents, teachers, and I would say each one who has played a role in bringing you up to this level. Of course, I do agree that it has been your hard work, your dedication, but please do not forget to thank your respected teachers and your parents who will always remain your best wishers. At times we at this age, I have two young daughters, and you people often feel that parents are old fashioned, they are of the previous generation, they don't know what are the demands of the present day world is. I can assure you your parents will always remain your best wishers in this world, and wherever you are, whatever you achieve, never forget to look back, ask them as to what you are doing, what are their expectations. Well, you had the brains in your head. Now, with the formal education that has been imparted by these very esteemed teachers and this empowerment, you have the wisdom as well. Your thoughts, your discipline will now determine the ultimate success. And success, especially in science, is not a splash in the pan or a stroke of luck, which sometimes we tend to believe. It is, in fact, the result of a very realistic, innovative, creative thinking, because doctors have to be thinkers and then we have to implement that. Maybe even we can dream at times, but what is required is hard work. Karma is required. Unless your dreaming, your thinking is supplemented with karma, your hard work, one doesn't really reach far. And I would say the ultimate goal of any individual, and so should be yours also, is to be happy, to be at peace, and to be satisfied. So enjoy the journey as it comes by and look for small events of success that they keep coming back. There is no ultimate destination in life. Ultimately, life is a journey, it's a process, and we have to, just as we are trying to enjoy today, we have had such a great fun actually. So many of you got degrees, we got the chance to meet each other. So learn to enjoy every moment. Always, I would say, have positivity in your approach and try to find solutions, because as doctors, as physicians, as lab in charges, you will have problems. Never develop a habit of lamenting over problems or over limitations. Use such problems as opportunities to progress and to improve. Negativity is going to pull you down, and positive mindset is something which will always make you fly. As a father of two daughters who are in this very profession, I'm so happy to see girls actually. So many of the girls have been awarded prizes. In fact, when I did MBBS in 1977, 81 is my exit, so 77 is my batch actually. We call it as GOMCO 77. We had 40 girls and we had 110 boys. Now I believe the boys hostel, the junior boys hostel where we used to come to, actually has become a girls hostel, since you have two girls hostels and one boys hostel. So there is a change, there is a shift. Just like many other changes, many other shifts are happening. In my own field of cardiology, I would say last year, out of the 160 odd endowments, 102 were girls. So girls are entering into fields like orthopedics, neurosurgery. There are no actually bridges now, and boys and girls are equally doing well, I would say, in this world. In fact, this year's 2023 Nobel Prize has been won by a lady, Katalin Kariko, along with Dr. Weizmann. This lady, Katalin Kariko, is from Hungary and she's a biochemist. And she works actually on the nucleoside based modifications. And you all know the Pfizer, the Moderna, mRNA vaccine that came up at the fastest pace that human beings could ever imagine was actually a creation of this two group. And now the mRNA is being used for many other vaccines and also for cancer treatment also. In fact, out of the 6 Nobel Prizes this year, 2 have been won by women. And the other one is Nargis Mohammadi, who won it the Nobel Peace Prize for bringing out the miseries of actually women in some countries. So friends, medicine today offers you many more opportunities than it did in my time as graduates. You can imagine from the time I graduated, there were no ultrasounds, there was no CT, there was no MRI, there was no mobile phones also. And in fact, when I went to PGI, that's the time we used to actually, pagers came up and we used to have a pager and we used to really feel very empowered that I have a pager and I am in contact with my ward all the time. So look at the volume of change that has happened in ever since I joined the medical school. And you can imagine that the volume of change by the time you are of my age. So all those new things you will be imbibing. It's a very challenging period, exciting, and of course it will be a continuous learning that you will have. Since medicine today is reached a stage where we practice more personalized, more participatory by the patients, predictive, we are able to predict diseases, and of course precision medicine is today the key word, because we don't want to treat 5 carcinoma cervix patients as the same. We want to treat each individual by the genetic makeup, by the phenotype, and it's a precision based medicine that we are today trying to do. The Human Genome Project, which finished in 2003, was one of the biggest landmark. And ever since then, you all know genetic engineering, genetic editing by the CRISPR technology, gene therapy is now helping us to not only diagnose, prevent, but also treat many more diseases. And it is said that genomics to the 21st century is something that infections were to the 20th century. So you are going to embark into areas which I at that time had no access to, and you will actually, with the new things like 3D printing, advanced imaging modalities, robotic surgery. Now India has developed a robot, costs about 15 crores, but a new Indian robot has come, which is there available in Punjab also, which is for 5 crores. So some of these things are now getting cheaper and they are becoming available. Electronic health records are going to come up. In US, every patient carries. India has a very ambitious project by which every patient of ours will have electronic health actually records. And so the practice of medicine is going to change. It has already changed, but in the next coming years, it's going to change further. Internet of Things with sensors. You all wear this Apple Watch, wearables, implantables. We implant so many devices in cardiology, and the new ingestible ones the GI people are doing. They are all going to give us more and more information of a patient. And in fact, now from the home, the toilet seat, the bed, some of these sensors actually are so sensitive that they will tell you, you will be able to diagnose diseases at a much faster pace. Artificial intelligence, machine learning, Watson-like technologies, easy access to large databases, they are all going to make you more capable and effective than what me and some of us sitting on the dais are. You will be able to cure many more diseases than all of us could ever do. However, at the same time, this is also a challenging and a demanding time because patients have started expecting more from us. Medical knowledge and practice are moving to the public and digital sphere. The caregivers team approach now, there is a team approach which we are following, and that has given way to the physician's single-handed dominance. We were all used to, since most of us, you and all these people, we were all toppers in our school, we were used to having a feeling that what I am doing is right. But today medicine is changing. Medicine doctors have to now accept people from the other fields. You will have to work with IT specialists, health administrators, technologists, and those who will develop collaborations, those who will be more accepting and more working with other, they are the ones actually who will be more successful. As Charles Darwin said very rightly, it is not the strongest and it is not only the most intelligent who survive, but it is the ones who are most responsive to change, who are ready to embrace change and work according to that. They are the ones who are going to be more successful. There has been some erosion in the high esteem this noble profession had. There are reasons, I don't want to dwell into that because you know there are some reasons within us and there are some reasons from outside also. Also now patient has many more choices. When I did my DM in cardiology, I was probably the third cardiologist in the state. Today, Ludhiana itself has 60 cardiologists. So patients have a choice today. And we should not forget the art of medicine. Now that's something, this technological boom that has happened, it should not take away the humane aspect, the art of medicine, because age old, my father, Vishal's dad, so many of you are doctors' children. Our parents actually had much more respect from their patients than we are able to, because the art of medicine was being practiced more closely by them. And I expect you youngsters not to lose that art of medicine. Be caring, be humane, compassionate, and empathetic to your patients. At the same time, I would say be bold and confident, because patients today are even more demanding than what they were. I want you all to pursue a compassion based medicine. But there is a new term which has come up. If someone cannot, because the way you think, it's more difficult to change, but the way you behave can be changed easier. At least we will have to practice etiquette based medicine. The way we conduct ourselves in the wards, the way we conduct ourselves in the world has to be actually behoving of the profession that we are in. Never forget, friends, that the patient is the most important in any healthcare system, the most important person. This one lesson, if you can carry from us today, I think it will stand by you for the rest of your life. Anything that is good for the patient is good for all of us. There are no big, powerful, or highly placed doctors. There are only good doctors who help their patients with the sole motive of giving benefit to them. If you follow this very simple principle, we assure you that you will do well in life, and you will also be very satisfied in your life. In the end, my best wishes and the best wishes of your parents, these very respected teachers, they are always going to be with you. Never lose an opportunity to come back to your institute here, because this is the place where the foundation has been laid. Remain connected with your classmates. You're going to go to far away different places, but keep the connections that you have today. Those are very precious, because you have spent the best time of your life, the 5 years of medical graduation here. So keep connected to these people, and I am sure you will come back with greater laurels. In the end, I would end with a verse from a famous poem by Rudyard Kipling, If. Rudyard Kipling says, if you can keep your head when all around you are losing theirs and blaming it on you, if you can trust yourself when all men doubt you but make allowance for their doubting too, if you can wait and not be tired by waiting, or being hated, don't give way to hating, and yet don't look too good nor talk too wise. If you can dream and not make dreams your master, if you can think and not make thoughts your aim, if neither foes nor loving friends can hurt you, if all men count with you, but none too much. Yours is the earth and everything that's in it, and what is more, you will be a man, my son, you will be a woman, my daughter. Thank you.